Good morning and welcome to the America's Health Ethics Virtual Forum. My name is Andrew Blasey, Technical Secretariat for this event and Director at Crowell & Moring International. Thank you all for joining us from across the region. We will begin in just a few minutes as our opening speakers prepare to take the stage in Brasilia. Again, welcome to the event and we will be with you in just a few minutes. Good morning and welcome to the America's Health Ethics Virtual Forum. My name is Andrew Blasey, Technical Secretariat for this event and Director at Crowell & Moring International, joining you from Washington, D.C. Is it an honor to welcome all of you to the largest gathering ever held in the Americas focused on reinforcing ethics in health. With nearly 1,000 delegates joining from across the region, from Canada to Chile, and representing all aspects of health systems and the wider health economy, from diverse government agencies to civil society, including patients and healthcare professionals, to the private sector. Before we begin, I have two logistical reminders for all participants. First, to listen to the forum's remarks in English, Portuguese, or Spanish, please use the interpretation button, which is located at the bottom of your screen, and select the language you prefer. This interpretation button will be available for the entirety of this two-day forum. In the event you become disconnected for any reason or are having trouble with the calendar link for this event, you can quickly rejoin the forum at any time from the forum's website. A live link has now been activated. Now I would like to turn the floor to the forum's live stage at the Pan American Health Organization in Brasilia and introduce you to Dr. Socorro Gross Galiano, lead representative of PAHO and the World Health Organization in Brazil, who will provide a welcome greeting. Dr. Gross, the floor is now yours. Dr. Gross, I believe your microphone is on mute.
Can you hear us? ¿Me escuchan?
We can hear you now. Please go ahead, Dr. Gross. Thank you.
Good morning. Welcome to Health in Brazil, the organization, Pan American Health Organization in Brazil. Welcome, everyone. It's an honor to receive everyone here today. And I'm very happy to have everyone, and I'm very glad to be able to reach our vaccination goals. Today we have 75% of the population and with the first doses and 35% with the first dose. This is very important for a country as Brazil, and it shows how together our public health system was able to move towards this goal in Brazil. So, a hand. Let's give it up for everyone. I would also like to thank the Executive Secretary Marcelo Pacheco, who is online with us, and the team who are also on our opening table today: Carlos Gouvea, Bruno Boldrin, and Eduardo Ministri, who's the president for the administration. Today, for us, it really is an honor to be able to have you guys here on the PAHO WHO. And ethics in health, health ethics is very important for us, and everyone is related to health, but we also have everything, you have doctors who know everything from the moment when we started, health ethics to when we are actually exercising our profession of medicine. And when we talk about health ethics, we're talking about a lot of efforts that go beyond, which is, the health ministry, the government. And these are very high efforts in a world that is more and more globalized, in a world where the, research ethics, production ethics, commerce ethics for products that are for health, they actually represent in many ways. And it can represent the difference between life and death and a person's well-being. When we talk about products for health, we are also talking about products where the flexibility or this elasticity we all have it, but sometimes we don't have it in health. That's why it's so important to talk about efforts that are multifactorial and that go beyond the country in terms of transparency on the medication market. This is very important so that we can have more efficiency in what we are bringing to our public. And of course, when we talk about health in our countries, these are some things that are, depending on the region and depending on the country, of course, but especially on the markets, transparency and ethics, there are many ways, to deal with people's behavior, and it is reflected in all of those items so that we can be able to support them as well. What we want is universal health for everyone, independent on, regardless of where they live. And I would really like to thank everyone. And I would really like to have this event here for all of us so that we can have this, event. And we really wish that this event has a lot of positive results for everyone in health. Thank you and have a nice day.
Bruno. Bom dia a todos.
Good morning, everyone. First of all, I would like to thank and compliment what Socorro said. I would like to thank Dr. Marcelo Quiroga as well for what he's been doing for the Brazilian community. Don Graves, Deputy Secretary of Commerce in the United States, the representatives of all the other entities as well included in this forum. For ABIIS, it's an honor to be here in such an important event for the health sector in the American continent, especially in such difficult times that we have been going through. We have been improving our vaccination more and more, and it is a very important moment to strengthen our alliances and really to be able to guide our relationship with everyone in the health chain day by day. And this job of having this institutional strengthening and sharing knowledge as well, this work has been done by the entities in the health sector, especially over the last 10 years. I would like to highlight the creation of the Institute of Health Ethics. I believe my microphone is working. Creation of the Health Ethics Institute with ABRAIDI together with the Ethics Institute, the creation of the Coalition of Inter-American Health, which also is represented on this event. And today we have 21 member entities of 10 different countries on the American continent. And for the announcement that was done on the coalition in 2019, that all signing had an ethics of conduct in these countries to guide the knowledge, which was of course a big win that we had. That's why on this key moment for world health and especially for Brazilian health, it is important that we have medical principles that are a fundamental element of all health actors, so that we're able to make sure everyone will have support in public health and private health as well, and to eliminate distortions that will compromise the economic health of this sector, which is so vital for our society. So here I would like to thank Health Ethics. I want to say congratulations for the event. Thank you, Minister, for being here. You being here is very important, and I wish everyone a great event. Thank you.
Bom, em nome do Instituto Ética da Saúde, eu gostaria de agradecer.
In name of the Health Ethics Institute, I would like to thank Dr. Socorro once again for giving us this symbolic space, which is so important once again, and our effort in search of sustainability on the health sector through good ethics practices. I would also like to thank, in the name of the minister, to say hello to all authorities present here physically, virtually, because to us this is very important. And without forgetting all the entities that are helping us in this great battle, the effort for searching for ethics is only possible through the collaboration of all players in the sector. And here I would like to name a few in name of all that are present. ABIIS, ABRAIDI, PROS, ANAPHARMA, FASA, configuration of holy houses, and all the others that have been helping on our great struggle for ethics and integrity in a way to reach sustainability. And just to start the event, I would like to announce Dr. Marcelo Pacheco from Guaranys, Executive Secretary of Economy in Brazil, and he's going to show us the importance of ethics and integrity on the perspective of economy, which is essential for the access of patients that have more quality products. So welcome, Dr. Marcelo.
Thank you, Carlos. Thank you, everyone.
Primeiramente, cumprimentar meus colegas de mesa virtual, cumprimentar o ministro Queiroga, todos aqui presentes.
I would like to say hello to all the people present on this panel. On behalf of Minister Paulo Guedes, this is a very important moment in the tributary reform. The minister is involved in a lot of negotiations that are very important for our work. And that's why it is my honor to participate in this event with you. Ethics in health is the theme of this important event. It's extremely important for our activities as civil servants. We are here serving the population. We are here working with taxpayers' money to serve the population. And to do that with ethics is vital for attaining our goals. When we talk about health, that is so much more important. It's a service to the citizens, which has been the focus of our activities in the last year and a half. At the Ministry of Economy, we're dedicating our focus to the economy, to fighting the pandemic. The Ministry of Economy has been created in the Bolsonaro term to promote the economic reforms, the huge economic change so that the country can go back to growing in a sustainable way. So that's why we joined 5 ministries so that we could change the economy in Brazil. We had the diagnostics of expending a lot of taxpayers' money, and we have to improve our spending. And on the other hand, it's important to improve the business environment so that the private sector may be able to develop itself and may help growing the country and invest and employ in a sustainable way. So those are 2 pillars that made us create this ministry in 2019 towards the reforms that the country so much needs. We are also focusing on the pension reform, the fiscal reform. We're just debating the administrative reform and also privatizations. So decrease the government spending in unnecessary things so that we can spend more in what the population needs. On the other hand, on the business side, we are here to make things simpler so that we can produce more in the country. We are diminishing red tape, providing the fiscal reform so that companies may be able to spend and invest with more ease. We are changing regulatory frameworks so that we can open more the trade. Our mission is to promote economic growth in a sustainable way, increase competitiveness, and generate more jobs. We have conducted an intense work in 2019 with our pension reform, our biggest reform so far. And in 2020, the crisis of the pandemic hit us. So we turned our focus completely in a week in order to be able to deal with the effects of the pandemic, to allow that everyone had access to the means and resources to fight the pandemic, and at the same time diminish the economic effects for the population. We focused our measures in 3 big groups: support to the vulnerable groups, so that people could stay at home and protect themselves from the disease, and while also being able to have support so that the informal population, the population that were not eligible for unemployment support, were provided the resources. We also looked at the companies and flexibilized the job contract so that people were not laid off and were able to have their income and be able to be rehired so that we could hinder the effects of the pandemic. We also provided resources from different ministries, defense, education, health ministries, providing all the measures for fiscal balance. We flexibilized rules so that the pandemic was fought with all the tools that we had available. We dedicated ourselves during the first 6 months of the pandemic, and once those tools were working, we went back to dealing with the reforms. We had an economic effect generated by the pandemic in terms of economy. And so we are now working on going back with the economic levels that we had before the pandemic. So to change our focus to fighting the pandemic and then going back to working on economic reforms requires governance of this ministry so that we can improve population's lives. So ethics and integrity are essential values in our work process so that we can deliver everything with the confidence of the population. I would like to mention the report of our integrity plan written by Minister Paulo Guedes. In order to the deliveries to be consistent, they have to result from the work and dedication of everyone with integrity. Integrity has to be translated as the behavior of the leaders in the engagement of all civil servants. Integrity promotes confidence, and confidence and trust is essential in all relations in the government. With no trust, people do not believe that we are adopting the right measures towards growth, and that's very important. Integrity is a governance principle. It implies to guarantee that the deliveries have sense and consistency because they are following technical standards and ethics behavior from the leaders. The OECD says that there are ethics standards in their alignment so that this is followed in both in the public and the private sector. Integrity is an ingredient important for every decision-making and interaction that is conducted. In the Ministry of Economy, an integrity failure is a risk of reputation that may halt our execution. We conduct relations with other entities. We conduct control of a lot of contracts, and it's an environment that has the risk of failure of integrity. The OECD alignment indicates that corruption is one of the most corrosive problems in our world. It creates polarization in politics and reduces trust in the institutions. Corruption impacts the well-being and wealth distribution. The OECD recognizes that civil society, everyone is important in the political arena. So that requires collaboration among all bodies of the society to reduce corruption in the public sector. In order to do that, it's vital that we have guidelines that are conducted by our leaders in the government to all the bodies that are part of the public sector. So our integrity programs have to be integrated with other government bodies so that we can mitigate the risks of integrity, like nepotism, conflicts of interest that are among our public and private sectors. That is also important in the economics arena, and we need trust. We need to believe that the institutions work, and we are all working towards the well-being. So integrity has to be translated in the behavior of our leaders in the government, like engagement and commitment of all civil servants. It promotes trust, and trust is essential in the relations of the society, economic agents, and the government. Integrity is also essential to promote policies, processes, and activities. There is no tolerance of ethics deviations. Everyone's commitment has to be delivered with efficiency and efficacy, with ethics and integrity. The integrity system of each ministry of the government should promote these integrity programs throughout all the government bodies in order to mitigate fraud and corruption. We all have to be vigilant all the time so that our behaviors are not deviated and show the society that we're doing that. Like I said, in the economic arena, we are working on the fiscal management so that we can use public resources, the taxpayers' money, in a responsible way to serve the population. A second goal would be to improve governance. We're digitalizing services, improving the services to the population, and providing more transparency. And lastly, aiming at more productivity and competitiveness, creating an environment so that everyone can invest and develop themselves. The deliveries in these three arenas require integrity in the formulation and monitoring the policies of the government. Here at our ministry, our integrity program has been implemented since 2019. working together with the Ministry Wagner Rosario, who will also be speaking at this event. Once we were able to deliver with the highest level of integrity, I'm sure that we will contribute to creating an economic environment with more ethics, promoting its development. It will avoid the losses due to corruption. It will demonstrate that Brazil is aligned with the most developed nations in its integrity policies, including the nations of the OECD, the organization that we want to be part of. We want to also increase relations between the public and private sector. We have to know how to deal with the private sector. There's no rejection, but we work together in an ethical way to deliver what the population needs. Specifically in the health area, ethics and integrity is important to serve the population, like I mentioned before. Considering the intense relation between economic agents, it is important to reinforce our integrity programs in all instances. And that means the procurement of medication, vaccines, and inputs necessary to fight. And that's the pandemic, for example, and it's important that the population knows that we are doing our best to deliver the best results. I would like to mention also the relation between regulators, and for the first time, we've seen regulatory agencies going on live TV to guarantee the trust in the use of their products. Safety in the consumption was evident during the pandemic. And we also have to work in a different way so that we can deliver vaccines, medications, everything that was a tool to fight the pandemic. And also guaranteeing that we were able to have the safety in the use of each product. That's why it's really important to consider ethics and innovation. We had to be innovators during the pandemic, and all these moments have to have ethics. These moments are able to conjugate ethics and integrity so that everything can be done to provide better results to the population.
I hope that these 2 days are great for us to be able to see ethics and innovation and delivering better service to the population. Hopefully we can learn the best lessons possible for our lives working in the public sector and health professionals as well. Thank you so much for the invitation to be here, and I wish that you guys have a great 2 days of debate and interaction. Thank you so much.
Thank you, Mr. Executive Secretary, for your inspiring words to help kickstart this week's important forum. I would now like to turn the floor to Scott Whitaker, President and Chief Executive Officer of the Advanced Medical Technology Association, or AdvaMed, who will introduce our next opening speaker. Scott, over to you.
Good morning to forum participants joining across the Americas and around the world. It's an honor to be with you today, and it's my pleasure to introduce the Honorable Don Graves, U.S. Deputy Secretary of Commerce. Today's event serves as a key milestone for the Western Hemisphere, as this is the largest and most diverse gathering ever held to foster ethics and integrity across the region's health systems. The Advanced Medical Technology Association and more than 400 companies that we represent are proud to partner with so many leading organizations to convene this program today. AdvaMed has been a leader in promoting and fostering ethics and integrity throughout the medical technology industry, and we could not have a better partner in this cause than the U.S. Department of Commerce, especially people like Ian Saunders and Lynn Costa and their colleagues at the International Trade Administration. Deputy Secretary Graves, on behalf of AdvaMed and the entire medtech industry, I thank you for your leadership as we take our focus on ethics and business integrity to new heights at home and around the world. For those of you who don't know him, Secretary Graves is the 19th Deputy Secretary of Commerce. He served as counselor to President Joe Biden during the 2020 presidential campaign, and prior to that, was executive vice president and head of corporate responsibility and community relations at Key Bank. In this role, Graves led the bank's corporate responsibility team, sustainability work, stakeholder engagement, and outreach. Under President Obama, Graves served as counselor and domestic and economic policy director for then Vice President Biden, as well as executive director of the President's Council on Jobs and Competitiveness. Mr. Secretary, thank you for being with us today. We look forward to hearing from you.
Thank you, Scott, for that kind introduction and for your leadership on behalf of the U.S. medical technology industry. We're proud of AdvaMed's global leadership throughout the pandemic and over the past decade in driving ethics and compliance for thousands of companies. I also want to congratulate Brazil's public and private sectors for stepping forward as the regional champion and virtual host of this vital and timely event. It's an honor to speak with participants at the outset of the America's Health Ethics Virtual Forum. Over the next 2 days, we'll witness hundreds of leading public, private, and civil organizations come together across the Western Hemisphere to make real progress in elevating standards of ethical conduct. This progress could not come at a more critical time as the region continues to grapple with the COVID-19 pandemic. More than ever, the pandemic has underscored the importance of collective action. Ethics and business integrity are not only at the heart of patient well-being, but they're also at the heart of sustainable commerce and economic growth. No sector, especially the healthcare sector, can reach its potential when confronted with the headwinds of unethical decision-making. An uneven playing field gives rise to inefficiencies and questions of quality, something that we should never have to worry about in healthcare. As a cancer survivor myself, I know that our lives depend on not having these kinds of concerns. Small and medium-sized enterprises, or SMEs, across many aspects of healthcare systems face particular risks. We must prioritize the success of SMEs in this field as they play a critical role in strengthening our economies more broadly. This means creating capacity-building programs for those companies, fostering commercial environments that reward ethical growth, ensuring resources are available to support small and medium-sized businesses, and focusing on diversity and inclusion so that the voices of those who have been systemically left out are duly recognized. Diversity is essential for bringing new ideas to the forefront of healthcare, and I'm so pleased to see so many women in patient advocacy groups, as well as civil organizations, contributing to this event. Governments across the region, including the United States, also have an important role to play in this regard. We need to tap into our convening power to drive ethical collaboration, because far too often, ethical lapses occur when trust among governments, healthcare providers, and healthcare recipients is low. Governments, on behalf of their citizens, can bring these actors together by creating spaces for open dialogue and action. Countries like Chile, Peru, and Brazil have created these spaces with a wide array of healthcare stakeholders, health ministries, healthcare associations, regulators, procurement officials, and civil organizations who met on a regular basis to draft a consensus framework. They started with a high standard code of ethics and then took the next step to forge a consensus framework, which is a voluntary and principle-based commitment by all healthcare stakeholders within a country to facilitate an open and transparent healthcare system. In the pharmaceutical sector, the International Federation of Pharmaceutical Manufacturers and Associations, or IFPMA, and the Latin American Federation of the Pharmaceutical Industry, FIPHARMA, will actively support your efforts in establishing a gold standard code. Ethical conduct is central to every healthcare decision made, and ethical standards do not come at the expense of reduced competition or higher prices. In fact, quite the opposite. Quality goods and services start with ethical conduct. Governments should also recognize the important role that the implementation of cross-cutting good regulatory practices, as well as regulatory convergence aligned with international best practices, play in eliminating corruption in the healthcare sector. We need to do everything in our power to promote resilient supply chains in healthcare products, reduce barriers, and build back better, not only in the U.S., but across our region as we recover from this pandemic. By doing this, we can ensure we're fully prepared for the future. I'm impressed with the agenda you've organized for this event, including all the key stakeholders you're bringing together and topics you will address. In your mission to build a better healthcare ecosystem for the Americas, you'll benefit all of us, regardless of where we live and where we come from. I congratulate all forum's partners, including our U.S. Department of Commerce colleagues, who are making this progress possible. I encourage you to take advantage of the experience and wisdom gathered in this forum and seize this opportunity to drive high standard results. At the U.S. Department of Commerce, we wish you great success this week and look forward to hearing the outcomes. Thank you.